Hello guys, welcome to another episode of Nashty. It's about you and me. So, today we're going to talk about the after surgery care for gynecomastia. I've already discussed what preparations you have to do before the surgery. So on this vlog episode, we will focus on the after surgery care. What are the things that you have to do after you've had your gynecomastia surgery. Right after you had your gynecomastia surgery, especially if you had general anesthesia, of course the feeling won't be the usual yet. For example, your senses could still be impaired. You don't really feel much yet, even on the area that was operated on because of the anesthesia, regardless if it's general or local, but more so if it's general. So again, you have to have someone with you who would, assist you in doing even the simplest of things, like just grabbing a glass of water, or, if you probably want to eat or something. So once the effect of the anesthesia wears off, of course, you will start feeling the pain. So it's important that, you get to rest for at least, 2 to 3 days after the surgery. So if you're working or you're still a student, you should carefully choose the date of your surgery. Put it probably near the weekend, or probably if you're going on a holiday break. So choose the time that would allow you to get some rest. So I suggest 2 to 3 days. That would be enough. Aside from that, normally the doctor would prescribe you some antibiotics. Well, it's not really required. I've read it, but just in case, like any surgery, there could be complications, there could be an infection, so the antibiotics would definitely help fight that one. Aside from antibiotics, the doctor would sometimes also prescribe you painkillers, in particular Arcoxia. So it's a very strong painkiller, so that even when you don't feel the effect of the anesthesia anymore, you have something to to make the pain more bearable. After your surgery and you're now resting at home, you would still have to go back to the doctor for some checkups. The first of which would be the removal of your sutures or the stitches in the area that was operated on. It's only the doctor or the surgeon that can remove it, properly. If you try to remove it yourself, you can probably, cause some bleeding, or you probably don't want infection too. So there, you do it normally within 5 to 7 days after your operation. So that's the first time you would need to visit your surgeon. And then there is at least a couple more after this, but this may or may not apply to you depending on how your body recovers, on how the healing process starts. So the second one would be SEROMA aspiration. So what is SEROMA? As mentioned in my first vlog in the series, SEROMA is this clear fluid that fills the area that had been operated on, because basically since the tissue has now been removed, that area is now hollow, and what your body would do is it would fill it with fluid. And this is where the aspiration comes in, and it's only the doctor who should be doing it. Please do not attempt to do it yourself. So basically he would get an injection and inject it to your chest area, and then he would remove the seroma. In my case, I had a lot of seroma that sort of filled my chest area. I think on my right side I got 25 cc, and then on my left I got 15 to 20 cc. So it's important that it gets removed, otherwise your chest area would look bloated or something. It's like you had silicone implants, so you want it removed. It's also important that for seroma not to to occur, or if you want to lessen it, you would have to put on, you know, the elastic bandage that, you know, the doctor has required you to put on, because when in constricting your chest, you know, there would be less seroma accumulation. Okay, so that's the second one. Then the third visit, it's not really required as well, but normally here you would have your steroid shot or steroid injection. So of course we all know that steroids help in, you know, lessening the inflammation of something, you know. Here the purpose of the steroids is to lessen the scar tissue and to soften it, because, you know, when the scar is already healing, you would notice that, you know, the inside part, like for example here in my chest area, here, especially where the incision was made, if you try to press your finger against it, it's a bit tender and like there's some hardness that you can feel. So that's basically the scar tissue. It's healing, so it gets hard. That's why you also need to massage it. So there, the steroid injection would help in lessening deformation and softening the scar tissue. So another part of your after surgery care, I'm sure those of you who had, you know, undergone operation already, gynecomastia surgery, you know this, you have to put on bandages and your compression vest. This is a sample of an elastic bandage, okay? So see, it's stretched. Sorry, this one is kind of worn out already because I've worn this several times already. And then of course you also need your this one. This is the compression vest, compression garment. You can get this, I think they sell it in online stores like Lazada Philippines, probably Shopee. Mine was provided by my surgeon, so I paid for this one as well. I don't know how much it costs, but yes, you need that. So how do you put on the elastic bandage? So let me demo it. So here you have to just, normally you have to ask somebody's help to put this on because it's kind of hard to put on by yourself. So I tried to put it on by myself. Obviously it looks not so good. As I've said, you have to have someone to help you in putting this one, and make sure that it's tight. It's, you know, it really constricts your chest. The reason for that is you don't want seroma to accumulate, and the second reason would be of course it would help in, you know, in the healing process of your chest. So apart from the elastic bandage, you would also need to put on your compression vest. So let me put this one on. So it's here now. As you can see, it's quite tight, and you know, you can actually just wear the compression garment within your usual clothing. So if you're going to work and you wear like long sleeves, you can just wear this inside. If you wear a t-shirt, you can just wear this inside. It's actually quite nice because it keeps your figure slim, like, you know, the way it contours your waist area. But again, the main purpose of this one is not for your waist or your tummy. It's to compress the area that was operated on, which is your chest. I have my elastic bandage inside this one, and then I have this one, the compression vest or garment, outside. So there, So for the compression garment and for the elastic bandage, you have to wear both religiously, like all day, every day. You would only need to remove it when you're going to take a bath, or probably when you would be massaging your chest area. But other than that, you would have to wear it all day, every day. I know the feeling. Sometimes it hurts because it's very tight, and it would, you know, cause some, I don't know, some redness in the areas that are really very tight. Sometimes it's itchy, especially that you can't do anything about it because it's inside and it's covered. But yes, you have to put it on. It's like mandatory, it's non-negotiable, it's a requirement. Just remember, the main purpose of putting on those two is to facilitate the healing process, meaning so that, you know, remember, something got cut off in your chest area, the tissue, so you want to make sure that the skin above would attach to the muscle beneath it. So that's why you compress it, and at the same time you don't want seroma to accumulate. So when you remove the vest and the bandage, make sure it's like 30 minutes max per day. For the bandage and the vest, I think you would have to wear both for at least 1 month. Aside from the vest and the bandage, you would also have to massage the area that has been operated on. You can actually do it using your hand, but in my case, I bought like a roller massager. So this one, I know it's color pink. I got this from a I think in Japan store for like less than 150 pesos. So basically, this is what you want to do with it. So here you have to vigorously roll it. Like, I don't know if it shows in the video that I'm like pushing it really hard, but you have to do it hard like this one, so that you want the skin to attach to the muscle beneath it. And then same here in the middle, like that, and then the other side there. So you have to do it, you know, vigorously. So if you can do that like twice a day, 30 minutes per session, then I think you're good. So what if you don't have this massager? So you can just use, you know, the palm of your hand and then put it like this, and then you massage the area vigorously. It's kind of tedious, especially if you use your hands. That's why, you know, again, I bought a massager, so I use this one so that it's easier. So aside from massaging it, of course, there's surgery that was done, and then there's some stitching. Of course, there would be scarring. You want that to disappear, or at least lessen its appearance. So what you need to do is, you know, use a scar remover. So this one is Dermatics. It's available in all drugstores nationwide. Probably not all, but most major drugstores nationwide. So this one is a 15-gram tube. It comes in 7 grams, I think. The price, it ranges from I think 700 to almost 1,000 pesos. So I suggest that you get the big one because you'll save more money with it. Plus, you can use it for a longer time, because the ideal length of use for the scar remover is about 6 months. So I don't know how fast I can consume this one too, because I'm still not done with one. So how do you put it? So just open the tube. See, I'll show you the, sorry, here it is one. It's Dermatics. So this one, you open it and then get like a small amount, just an ample amount, and then like apply it in the area that got, you know, operated on, the one with incision and scar from the stitches. And then here on the other side, like that one. So there. And in my case, because again I had liposuction, I have to apply it here as well and here. So basically the one they performed liposuction, I think here, you know, to put like some contours, like so that it would have shape already while it's, you know, recovering, it's healing. So I could still remember that, you know, after operation, like my entire chest area was full of like hematoma. So basically it's bruising, it's full of bruises, like entire chest area. So there. So then you just, you know, wait for this one to dry. Probably just a minute would be enough, and then you're good. So you just apply this one again twice a day, preferably, you know, after massaging. So I'm sure you would ask me, like, when can I go back to the gym? When can I, you know, return to working out so that I can now utilize my, you know, my brand new chest that's so, you know, manly and all that. Okay, so normally you should not go to the gym within, you know, a month after the surgery. What you don't want to happen is to cause more like bleeding inside. You don't want to injure your chest area further, so you want it to heal first. But if you can't wait and you really want to go to the gym, so probably after 2 weeks you can start like doing some cardio, like running or walking fast. You know, you can do anything that doesn't involve your chest area, probably even this one or your back. So you're probably just limited to like treadmill, bike, or, you know, those that make use of your legs and thighs. But, you know, anything that would concern your chest, you should avoid it. Personally, in my case, I went back to the gym after 2 weeks and just did cardio, and then I did some, you know, chest exercises after a month already. So that's when I did like the bench press, the chest press, and, you know, all the other exercises that you can think of which involves your chest area. Well, I've enumerated the after surgery care for gynecomastia surgery. I hope you guys learned something from it. You know, if you have questions, you can ask them in the comment section. And as I've said, I hope you find this video informative and useful. Thank you so much for tuning in. If you like this video, don't forget to give it a thumbs up. If you're new to my channel, please consider subscribing. Always remember to be nice. I'm Nashki. Till then.